In the fourth section of the encephalitis diagnosis, let's talk about some imaging techniques that will be helpful in the diagnosis. And some imaging techniques, we know all the time we talk about these imaging techniques are the MRI, magnetic resonance imaging. Then we have CT scan. And in cases of brain involvement, we have EEG, electroencephalogram, which is the electrical recording of the brain activity that tells us the level of involvement of the brain, is also an important imaging technique, and also the brain biopsy. So MRI, CT scan, and electroencephalogram. Neuroimaging studies identify or exclude alternative diagnosis. So it's these imaging techniques are helpful in actual diagnosis of the condition, in excluding the other conditions which can be in the differential diagnosis, or it is further confirmation of the diagnosis that is already made. So it's very, very important, all these imaging techniques that help us to further or to further confirm the diagnosis that is made. Assist in the differentiation, focal and diffuse process. Focal findings raise the possibility of herpes simplex virus encephalitis. So focal findings, focally, locally at one area, not diffuse all over the brain, usually indicate the herpes simplex virus infection. On MRI, magnetic resonance imaging, some examples of the focal findings, and I mentioned that focal findings are usually present in the herpes simplex virus encephalitis. So some examples of the presence of focal findings are the areas of increased signal intensity. So the focal area of increased signal intensity are present in frontotemporal cingulate region, insular region of the brain on T2 weighted MRI, and also flare or diffusion weighted MRI. So we have some examples of the focal involvement or focal findings. We have areas in which the intensity of the signal is increased in frontotemporal cingulate regions, insular regions of the brain on T2 weighted, and also flare or diffusion weighted MRI. Then also focal areas are present of low absorption, mass effect, and contrast enhancement on CT. Periodic focal temporal lobe spikes on background of slow amplitude are present, and then we have low amplitude and flattened activity on electroencephalogram. So see, these are some examples of the focal findings which are present on the imaging techniques like CT scan, MRI, and electroencephalogram. So we have areas of increased signal intensity, then we have some focal areas and also focal temporal lobe areas. So these are the example of focal findings. Next, the PCR polymerase chain reaction documented herpes simplex virus encephalitis. Usually they have normal MRI. 80% of patients have abnormalities in the temporal lobe. This is the temporal lobe. Additional 10% is in the extratemporal region, and then we have hypertensive lesions are present on T2 weighted images. So we are specifically talking about herpes simplex virus encephalitis because herpes simplex virus encephalitis mainly cause the focal findings on the imaging techniques. And 80% of the cases, it's in the temporal region, 10% is in the extratemporal region. Next is sensitivity enhancement on magnetic resonance imaging, flare and diffusion weighted images. Herpes simplex virus encephalitis, we have atypical pattern of MRI. Involvement of brain region outside frontotemporal area. So all these are the changes that occur in the herpes simplex virus encephalitis on MRI. You can see there is enhancement of atypical pattern of magnetic resonance imaging. Involvement of these are the brain regions and outside the frontotemporal areas of the brain. CT and electroencephalogram, computerized tomography, CT scan, less sensitive than MRI. So MRI is very effective imaging technique for the diagnosis of encephalitis. Especially we talked about the focal findings of herpes simplex virus encephalitis. CT scan is less sensitive than MRI, normal in 20 to 35% of the patient. Electroencephalogram, it's the electrical recording of the brain activity like electrocardiogram. It is in more than 75% of polymerase chain reaction documented cases. EEG abnormalities are present, involve mainly the temporal lobe, are often non-specific. Herpes simplex virus encephalitis, distinct electroencephalogram pattern is seen in some patients. Periodic complexes between 2 and 15 of illness. West Nile virus encephalitis, significant MRI abnormalities are present. Involve deep brain structures, thalamus, basal ganglia, brainstem. So all these deep structures are affected in West Nile virus encephalitis as compared to herpes simplex, which was involving the temporal lobe or frontal temporal region. So this is deep, like thalamus, basal ganglia is affected. Apparent on flare images. Here you can see these are the regions involved, thalamus and basal ganglia. So it's apparent, more visible on the flare images. Electroencephalogram shows generalized slowing of the brain activity, more anteriorly prominent showing. Then we have varicella-zoster virus and cytomegalovirus encephalitis. Here the varicella-zoster virus encephalitis, multifocal areas of hemorrhage are present. Ischemic infarction is present. CNS vasculopathy tendency of virus. CMV encephalitis, there are enlarged ventricles, areas of increased T2 signal on MRI, and subependymal enhancement on T1 weighted post-contrast images. So all these are the findings of varicella-zoster virus and cytomegalovirus on the imaging techniques. Next, the brain biopsy. In those with cerebrospinal fluid polymerase chain reaction fail, we go for the biopsy of the brain, lead to specific diagnosis, focal abnormalities on MRI, those showing progressive clinical deterioration. So patients who are progressing in their symptoms, clinical deterioration, slowly progressing disease, we should go for the biopsy to find out the specific cause. Treatment with acyclovir supportive therapy. That was all about section 4. Thank you for watching sqadia.com.